Dr. Grubwald, first of all, thank you for your message, but more importantly, thank you for your passion and for your dedication of helping people. And, we see that in you and the difference that you're making in the lives of our children. We can't thank you enough, and everything that's done here at Kool Smiles. This is a fabulous place. I tell you, where I work, I don't see smiles. So it's nice to be here to see smiles that are really genuine, and you really do see in these smiles the future of America, and that's really special. So this is a moment that I really enjoy, and thank you for including me. You sort of talked about how it was when you grew up, but all we have to do is go back 4 or 5 years, and there's been a sea change in the way that we've dealt with oral health for our children in the last 4 to 5 years. Give yourselves a round of applause. You've done this. The people that are here have made a huge difference. A huge difference. I think we're quoting our former Surgeon General Everett Koop when you talked about oral health. Dr. Koop said that there is no health without oral health. Oral health is not just about the health inside your mouth. It's about your total health. And we know that dental disease is chronic, it's progressive, and it's destructive, and it's preventable. And that's what this is all about. DeMonte Driver was a wake-up call to America. Yes, it happened right here in Prince George's County. It was a tragic situation where a mom tried to get care for her son and could not find care. There was no Kool Smiles facility for DeMonte Driver and DeMonte Driver's mother to go to where they could have gotten care. That's just 4 years ago. It didn't exist. Access was not there. And as you know, DeMonte Driver lost his life because we did not have access to dental care for our children just 4 to 5 years ago. But we changed that. You changed that. You changed that. The people that you see sitting up here, the Maryland Dental Action Coalition. Thank you, Katrina Holt, for your work in making a difference for our state of Maryland. Maryland now leads the nation as far as oral health care is concerned. That's because we've had leadership. The DeMonte Driver Dental Project, Betty Thomas, has been there to make a difference for access to our children. And the Prince George's Health Department and leadership, and Elena Butler, we welcome you to your new position. And we look forward to the continuation of the leadership shown right here in Prince George's County. You're all making a difference. I said Maryland leads the nation. That's not my assessment. The Pew State of the Dental Health, when it ranked 8 benchmarks, Maryland was the only state that exceeded in 7 of those 8 benchmarks. That's good news. There's still one more we have to conquer. We still have work to be done. We're making a difference. I'm proud of what's happened in our government at the national level. An amendment that I offered to the CHIP Children's Health Insurance Program included mandatory coverage for dental care. Passed in 2009. And then in 2010, Congress passed the Affordable Care Act with an amendment that I offered that provided mandatory coverage for dental care for our children. So we have changed the landscape in this state and nation on oral health. But if you're going to be able to get your children the type of dental care they need to have access to that care. Access to that care. That's what this facility is all about. That's what Kool Smiles is about. It started in Maryland in 2008. They now have 8 facilities. They handle 10,000 patients a month. Just think, we didn't have that a couple of years ago. And now we have that. And I tell you, I am jealous of their approval rate. And the fact, I think the average wait time is 7 minutes. You know, you're going to make all of us look bad with those type of records. Your satisfaction rate's close to 100%. So next week, I'm going back to my office and I'm putting in these types of facilities here so that we can increase we always learn from each other. But I just really wanted to be here to say thank you. You give us such optimism about America's future. You know, this facility should have been here a long time ago. It's here now, and we're all benefiting from it. It's a relatively modest investment. I asked the question, I guess I always do this, I'm a member of the Senate Finance Committee, so I always ask the finance questions. How'd you put this together? And this is a private facility. Didn't take government money to set up this facility, but they needed to make sure that they were paid for the people who use the facilities. And too many families could not afford this. So that's why we changed the law to say we wanted to provide coverage, particularly for our children. So now our children have guaranteed coverage under our social insurance programs. There's a lot of private insurance that pay. But there's a lot of people who walk in here every day who cannot pay. Adults. We have to do something about that. Now, Kool Smiles is doing something about it by just making sure they treat everybody who walks in the door. Maybe I shouldn't say that because you might get more, but you do that. And you would sort of have to foot the cost. That's not right. We should make sure that everybody has adequate payment coverage for oral health. My point is this. This isn't a huge investment of government money, but it's sure making America's future a lot brighter, not just because of the smiles that are on the children's faces, because of the health that they will be and will help build a greater tomorrow. Congratulations.